All right, good morning, everyone. I know we have a very full agenda today, and so it is 9 o'clock, and we're going to get started just in the interest of time, knowing that we have a number of folks that do have meetings scheduled with their legislators this morning. So again, good morning and welcome everyone to Human Services Day at the Capitol. To start our day, and as we do with all of our meetings, let's say the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, thank you so much for doing that. My name is Sarah Diedrich Kasdorf. I'm the Deputy Director of Government Affairs for the Wisconsin Counties Association. And on behalf of everyone at the association, I'd like to thank everyone so much for participating in the Wisconsin Counties Association's County Ambassador Program's Human Services Day at the Human Services Day at the Capitol. Our CAP team and Human Services Day was started a number of years ago by now Calumet County Board Chair and then WCA President Alice Connors. Alice really thought it was important for counties to engage with our government affairs team and our legislative efforts. And I think as all of you know as well, Alice also was very much involved in the Wisconsin County Human Services Association, continues to be extremely supportive of human services issues, and thought just beyond a CAP team, she really felt it was important to hold a day specific to issues related to human services. So Alice, thank you so much for having this wonderful idea of creating not only a CAP team, but a Human Services Day at the Capitol. And I know you continue to participate in each and every one of our meetings as well. I'm sure you're out there somewhere, Alice. So again, thank you so much. While Human Services Day at the Capitol was started a number of years ago, we continue to exist because of the support of the WCA Board of Directors and our current leadership team. So at this time, I'd like to ask you to join me in welcoming the chair of the WCA Board of Directors, Lance Plimmel, for a welcome and some brief remarks.
Thanks, Sarah. Appreciate it. Good morning. Welcome, everybody, to our virtual CAP Team Human Services Day. It's not the way that I prefer to meet, but it's a viable alternative in this COVID world we live in. And we do have a lot packed into a short time today. As Sarah said, the Wisconsin Counties Association, we derive our influence from you, its members, and through events like this. We rely on each and every one of you for your input and your feedback as we work on crafting policy most beneficial to our member counties. As a member-driven association, our direction emanates from the ground up, and it's through your participation and guidance that we develop our platform and lobby for those objectives. We have a highly effective and successful legislative team with Sarah Diedrich Kasdorf, and Sarah's going to be leading most of the discussion today, and she probably knows more about the human service end of the business as anybody that I know. And I'm going to keep this pretty short, but as a real quick story, and a couple of you have been here maybe as long as I have heard this before, but a number of years ago, I was actually asked to address this body and welcome a group. I was extremely excited to do it. I thought it was, as a huge hockey fan and Badger fan, I thought it was the Western Collegiate Hockey Association. It turns out you have an extra S in there, and it's the Wisconsin County, Human Services Association, which I really didn't know anything about, but I learned that I had to quickly educate myself. I was a lot less prepared for that as you live in a world of acronyms and abbreviations. But I can tell you this, I learned a lot from your current president, Diane Cable, who was here with us in Wood County all those years. Diane was a great asset to us. I'm sure she's a fantastic asset to your association. And I welcome all of you today. I realize that between Human Services, DCF, the rest of you account for most of my budget, but you do provide outstanding service to your communities in programs that are extremely beneficial. So I'll leave it at that. I thank you very much again for being with us today, and I'll turn it over to those people who know much more about human services than I will ever know. Thanks, Sarah.
Great. Thank you so much, Chair Plimmel. Partnerships are so important, especially in county government. And our Human Services Day at the Capitol would not be possible without our valuable partners at the Wisconsin County Human Services Association. And so joining us today from WICSA for some opening comments is Diane Cable. Diane is not only the president of the Wisconsin.
Okay, well, thank you for those opening words. As Sarah said, I am Diane Cable, Director of Eau Claire County Human Services and the current president of the Wisconsin Counties Human Services Association, WICSA. And thank you, Lance, also for your leadership. And I think I was at that presentation where you mentioned about, is this the Hockey Association? So glad you're here with us, though, in the work that you do. I do want to take just a moment, though, before I say just a few brief words, to pause and ask you all to join me to pause in silence in response to yet another tragic shooting. We are here today to advocate for the needs of a human services system, and that responds to the needs of the vulnerable and responds to all in the midst of crisis. And we are in a crisis. We are a system that works to prevent, intervene, protect, and respond. And today, we are all affected by yet another violent incident. So please join me. Let us pause for just a moment for Dante Wright, for our systems and our communities. Thank you. And welcome. Welcome to Human Services Day at the Capitol, a day of taking action, advocating, and truly making a difference. A special thank you to Sarah and WCA for continuing to host and facilitate this event. We are grateful for your work and your partnership in bringing this day together and the formation of the white papers that inform, highlight, and guide our important conversations with legislators. Over the years, in partnership with WCA and our state partners, WICSA has become increasingly proactive in shaping policy and legislation. A number of years ago, we created an executive director position that has been critical to strengthening the voice and work of our association. Our current executive director, Katie Davis, thank you for all of your work. Our organizational effectiveness work has been instrumental in reaffirming and improving our association, foundations, principles, guidelines, and processes. And our policy action committees, the PACs, do incredible work providing leadership and subject matter expertise, establishing and setting priorities, goals, and work with our state partners, the Department of Children and Families, Department of Health Services, Department of Corrections, the Office of Children's Mental Health. We are grateful for our relationships and hard work with these partners and individuals who serve and work with us. Through these relationships and hard work, we have mobilized and elevated our voices as human services leaders. We are making a difference and having an impact on the system and ultimately the children, youth, families, individuals we serve. The last time we were here for Human Services Day at the Capitol, we collectively worked together to convey the need of child welfare funding. And while we still recognize there is need, we were truly heard. This past year of the pandemic, we have had so many learnings and experiences that we could have never, ever imagined. And we have responded within our agencies, our communities, and as an association. Areas of great attention and need have bubbled up: mental health and substance use services, food and housing security, and equity and inclusion. This past year, among many things, has highlighted the need for the investment in children, youth, families, individuals. The investment in human services is desperately needed. We are here today together to advocate. Now is the time for us to tell our stories of the need of our communities, the individuals we serve, the needs of our system, how investment in crisis services, youth services, mental health, income maintenance, even Medicaid expansion and resources to serving our children and families within their homes, communities, our state, is critical to support the mental and physical health and well-being of our communities. the well-being of the people of Wisconsin. Thank you. Thank you for listening, for your time. Thank you for the work you do. And I truly wish you great conversations. I turn it back to you, Sarah.
Nice. Thank you so much, Diane. As always, you provide us with such wonderful words to start our meetings, and I do appreciate all of your thoughtful comments. Way more eloquent than I could ever be. That is for sure. Again, I know, Diane, you mentioned Katie Davis. I did also want to give a shout out to Katie Davis, the Executive Director of WICSA, for all of her help with Human Services Day and all of the work that she does throughout the year on behalf of County Human Services and the individuals that we serve. You know, this year's Human Services Day will be like no other Human Services Day that we have held in the past. You know, unfortunately, we are not able to get together at a hotel here in downtown Madison. We're not able to, have conversations with each other. We're not able to share a meal together this year. So our experience is going to be a bit different, but that doesn't necessarily mean that our experience is going to be less productive. I have to say, as much as we like to meet in person, and we would love to have everybody in the Capitol, we just didn't think we were quite ready to do something like that. Every other group that I have talked to is continuing to hold all of their lobby days virtually. And I am hoping that by our October 19th meeting of our CAP team, that we will be able to get together in person and have some wonderful conversations, share a meal together, share conversation, all of the other wonderful intangibles that we get out of these days that unfortunately we can't do this year. But again, I want to thank you so much for participating in Human Services Day. I have to say that I wish we could get more counties, more people to participate in these days, because I cannot stress enough the importance of you as county officials building relationships with your legislators. And when I talk about building relationships with your legislators, it's not just what you do today. It is that continuous building of the relationships, reaching out and sending an email, picking up the phone, calling them, walking into their office hours in your local district, whatever it may be, so that when we come to them on days like Human Services Day or some other time where there's some big piece of legislation and we send out an action alert, the first time you're contacting your legislator is not when we need something from them. So again, I thank you guys so much for participating in today's activities. And I encourage you, even after today, to continue to reach out, to continue to have conversations with your legislators, especially on the budget. I mean, we are just at the beginning of the budget process now. It is a long way between now and the time that the governor is going to sign the budgets. So we want to make sure that while we have this one day that we set aside for you to specifically talk to your legislators, we want you to keep these conversations going throughout the year. With that, real quickly, I think I'm just going to review our agenda for today. Let's see here. There we go. My mouse is acting up this morning, so I apologize if things are a little wonky. So I just want to real quickly go over today's agendas. Obviously, we've gone through the welcome introductions pieces. We will be getting to our guest speakers momentarily. Once our guest speakers are done, we will be going into our legislative briefing, where I'm going to try to take what ended up being much longer and way more complicated issue papers than I like to prepare for you and really pare it down into the most basic terms that you will be able to share with your legislators. Because frankly speaking, you don't have an hour or two. You could talk for hours with your legislators on all of these topics, and you may have 20 minutes, you may have 30 minutes in which to do so. So once we've completed our guest speakers, we will try to pare down these papers as much as we can for you, so that you feel comfortable sharing with your legislators what it is we think about a number of items that are included within the budget. In terms of the materials that you were sent, everything was sent via email this time around. There were 6 issue papers. The PowerPoint we're going through today was sent out to you. There was also a report back form that was sent to you as well. And I'll talk about the report back form in just a little bit, because it is important that we talk about it. And I want to stress later on the importance of why I would like to get those forms back from you. But with that, at this time, I think I'm going to move into our guest speakers. So we are really privileged today to have the leaders from both the Department of Children and Families and the Department of Health Services join us this morning. When I mentioned partners earlier, I would say that these two leaders have really forged partnerships with counties that we haven't seen from a number of previous administrations. I have to say it has been a real pleasure working with Secretary Amundsen over the last 2+ years. And then when we heard that Secretary Timberlake was coming back to DHS, we were really thrilled as well to have her join us. We've had a great relationship with her in the past as counties. We know she's going to come in here not starting from scratch. So we were really, really thrilled to see Secretary come back and join the administration too. I don't know who for sure is planning to go first out of the two secretaries today. What I think we will do is we will ask both secretaries to go through their remarks, and then we will open it up for Q&A. Real quickly, in terms of the formal part of the invite or of the agenda with the introductions, and I know if they're like me, you don't like it when everybody sits and reads your bio word for word. So I'll try to paraphrase some of what's in the bio. In the event we do have some county officials that are joining us today, county elected officials, county board members that maybe aren't overly familiar with the secretaries. But Emily Amundsen is the secretary from the Department of Children and Families. She was appointed to that position by Governor Evers, effective January of 2019 when he took office. She has over a decade of experience in state government and has a vast knowledge of children and youth programs and their interconnectedness to the health and vitality of our state. Prior to joining this administration, she did serve as chief of staff for now Governor Evers at the Department of Public Instruction. And during that time, she spent a lot of time and effort working on cross-agency efforts between DPI and DCF, including early learning, early and family literacy, after-school programming, intervention and prevention, homelessness, and youth justice. And then we also have joining us today from the Department of Health Services, Karen Timberlake. Karen, of course, comes to us from after 10 years away, I guess, from the Department of Health Services. She most recently worked at Michael Best Strategies, supporting initiatives in healthcare and human services transformation. I believe after leaving the Department of Health Services, she went to the Population Health Institute at the University of Wisconsin School of Medicine and Public Health, where she worked to ensure higher quality healthcare at lower cost with the Wisconsin Health Information Organization. When she was at DHS previously from 2008 to 2010, she was actually in charge of guiding the state through the H1N1 pandemic. And so couldn't find a better person to come back and lead us through this current COVID pandemic as well. So with that, I want to thank both Secretaries Timberlake and Secretary Amundsen for joining us today. I don't know if Secretary Amundsen is on yet. She is? Okay, perfect.
Sure is, yep.
Okay, perfect. Now, it's my understanding you guys have a PowerPoint presentation, so I'm going to stop sharing my screen, and then you guys should be able to share yours.
Fantastic. Thank you so much, Sarah. So while we're popping up the slides, let me just say a couple of words of welcome and good morning, and then I will turn things over to my colleague, Secretary Amundsen. So first of all, really want to thank the Counties Association and the County Human Services Association for the invitation to be with you today. This happens to be National County Government Month. And so what a fitting time to be bringing the voices of county staff, county elected officials, county leaders into our state capitol, even if it is virtually, to talk about the critical work that you all do. I know that I speak for Secretary Amundsen and all of our colleagues in both state agencies when I say that we cannot do the work that we do at a state level without the close partnerships that we have with our colleagues in county government in so many different ways. I also really want to underscore what Sarah was beginning to tee up for you in terms of the importance of advocacy around this budget. I know that for both of us in our agencies and certainly in our partnerships with Governor Evers and his entire team, your voices have mattered already in the crafting of the budget proposals that we're going to talk through today, and some of the things that I know you'll be advocating for with our legislators. And your voices will continue to matter as you continue to spread the word and advocate for what is really important for kids and families and communities and the work that you do in counties all across our state. And I'll just say, Sarah is a pro. She knows what she's talking about, and you should do absolutely everything that she tells you to do. So I also want to thank Lance and Diane for their warm welcome to us and for creating space in this agenda for us to spend a few minutes with you. So next slide, please. So with that, I'll just touch briefly on our agenda for our comments, and really do look forward to questions and conversation. So I'm going to turn things over in just a half a second to Secretary Amundsen to step you through some of the key provisions in the governor's budget as it relates to the Department of Children and Families. I'll then talk about a few things that are in the budget proposal as it relates to our work at DHS. And then I do think it's important that we just touch on the pandemic briefly, including some current events that I'm sure you're hearing about. So we'll wrap up there. So with that, I will turn it over to Secretary Amundsen and look forward to speaking with you again in just a few minutes.
Okay. Thank you so much, Secretary Timberlake. Really appreciate all of the opening comments this morning. I was taking notes on so many of the things that folks before me said. If I could just ask to advance to the next slide, please. I want to echo the thanks on taking time out of your day and your week to engage in the budget process. I've had the pleasure of meeting with so many counties over the past several weeks since the governor's executive budget was released, and really so grateful to the time and the space that each of you have committed to looking at the budget, thinking about it, thinking about how it impacts the children and the families that you serve, that you work with every day. The other thing that really buoys me in this process is many of you have shared you're already having the conversations with legislators in your district, that you have that relationship, that you are the person that your legislator calls when they want the real scoop on some of these priorities. That is such good news. And it means that it's not just the work of, of one day, it's that long-term relationship building, and it's that trusted collegial friendship that develops. And so really want to commend you on the work that you do every day to keep that relationship strong, and really glad to hear that work is happening. You are no better ambassador of budget priorities. We can do so much. We can do these advocacy days. We can tell you why we love this budget. But at the end of the day, we want to hear how does this impact children and families in Wisconsin? And you are so skilled at telling that story. And believe me, whenever all of you are talking, when I'm able to meet with you, I'm writing down your stories, and those are the stories that I tell, that I bring with me. So I also want to give just a special thanks to DHS. DHS recognizes and understands the value in connecting the dots between our two agencies, and we have a really trusted, robust relationship. They are our sister agency, and we function as such. It's a daily and weekly conversation, and I've been really lucky and blessed to have a lot of time with Secretary Timberlake already in her stint as interim secretary. So really appreciate that time. It shows that we're rowing in the same direction. I think this budget reflects a commitment to rowing in the same direction, and I want to tell you that our day-to-day communication reflects that same priority. So I want to spend my time highlighting 4 big issues which you raised as things you wanted to talk and learn more about. I know you won't have an issue paper on this specifically, but I wanted to start with early care and education today because frankly, when I talk with all of you out in your counties, I understand and hear how early care and education and our access across our state or lack of access to high quality, affordable childcare has an impact on the work that you do with children and families. And so I want to talk about early care and education in this budget because it's something we're very, very proud of. Wisconsin was a leader in funding early care and education through the pandemic. We've been able to direct a lot of emergency funding to this backbone industry. We've seen what happens. We've felt the impact in our communities as childcare providers have needed to close during the pandemic. And certainly if you're a woman in the workforce, you've seen the impact of a female recession happening during this pandemic that is very much related to our lack of access and affordability in the childcare industry. We really see childcare as an economic development issue out in counties across the state, and we believe that where there is affordable, accessible childcare, communities are going to thrive. And that is something that I think if you look at the recent report out of WEDC, you see that strong commitment to really viewing early care and education as part of what we view as the infrastructure we need to recover from this pandemic. Investing in the early childhood workforce and system infrastructure is how we get this done. So we've developed a new program called Childcare Strong. It's built off a lot of what we've learned during the pandemic around really focusing on ensuring there is that high quality, affordable access, particularly for infants and toddlers, and that the early care and education workforce is fairly compensated with a living wage. Another facet of our early care and education proposal is around expanding evidence-based programs. That's something that many of you know a heck of a lot about on the child welfare side. And this is an additional investment in social emotional learning, which is really designed to reduce the problematic disparity around expulsion of young Black and Brown, often boys, from early care and education programs. So when we talk about that equity and inclusion lens, and we talk about the primary prevention moves and steps that we can take to ensure our kiddos are ready for K-12, this is a critical investment. And then finally, want to highlight a $10,000 income disregard for direct care workers, and that would include early childhood professionals. This was a key recommendation coming out of the Governor's Task Force on Caregiving, and that is a key economic development strategy. It's also something that we hear a lot from early care and education workforce, that they are not able to send their own children to the center where they work because it is so cost prohibitive. So the reason I wanted to spend a little bit of time on childcare this morning is, while it's sometimes adjacent to the work that you do in health and human services agencies, I do want to surface the lack of affordable childcare and how that impacts your options for respite care, for targeted safety planning. And again, that concept that there is absolutely no better primary prevention for all kinds of undesirable outcomes later in life than a high quality early care and education program. So just want to make sure that that is not forgotten as part of the conversations you all are having. If I could get the next slide, I want to switch gears to what I would say the unsung heroes of counties, the child support agencies. So this governor's budget provides over $10 million a year for child support agencies. We're really helping to shift the focus of the work and support participants so that they are in a better position to support their families, both financially and emotionally. Child support agencies keep a relatively low profile in counties, but their impact on communities is absolutely great and critical. We have a wonderful child support program in the state of Wisconsin. We need to invest in it to keep it as such. Changes to reimbursement mechanisms at the federal level have really caused us to need to find that support where we can to keep our programs strong and solvent and efficient and effective at serving families. If I could get the next slide, please. So moving on to child welfare. This governor's budget also puts us in a position to put our families first in the redesign of Wisconsin's child welfare system in concert with the federal Families First Act. And what that looks like is a significant investment in programs that will allow us to draw down $4 to support our child welfare system. This is absolutely critical to unlocking, additional reimbursements from the federal level. A lot of focus is made on evidence-based services. We have a recognition across our state that evidence-based programs and services are very important to how Families First is funded. There's also additional discretionary funding within that $12 million pot for programs that are frankly working in your communities that may or may not be evidence-based, by some federal definition, but that are very important to communities across the state. So that funding, that focus on prevention funding is absolutely critical to how we start to make that transition to Family First. We also have an additional bump in the CFA allocation. Want to echo Diane's sentiments that, I met this group and I met WICSA and began to develop these relationships at a time where I was learning just how effective and how powerful this body, this entity can be when they went after and secured a CFA allocation increase 2 years ago. I want to see that investment continue. That's an important piece of the puzzle. We're also looking at an aggressive increase to kinship care to keep up and keep commensurate with the foster care increases, and then additional supports to help Wisconsin comply with Families First requirements and changes. That includes a focus on qualified residential treatment facilities and additional investment in opening a dedicated QRTP in Milwaukee County. I want to say just a word about subsidized guardianship, because I know that that's a conversation that many of you are having and that you'll be having later this morning. I want to be really clear that DCF would be supportive of a move to better fund subsidized guardianships. We understand and have become acquainted through Sarah's great work on the challenges that these present in an unfunded system. And with strict levy limits on your operations, we understand the pinch. Our simple ask to all of you as you sort of wrestle with these later today is that we find dollars for this outside of the items in the child welfare budget as it stands. These investments that I've ticked through in the governor's budget are just so critical to the way that Families First will operate here in Wisconsin, and frankly to the long-term change we're hoping to see in the system. Subsidized guardianship fits really nicely into that portfolio of work around Family First. But we don't want it to take away from these other investments that we're looking to make. So a little bit of a balancing act, but hopefully we're able to achieve all of it. And then finally, if I could get the last slide, I want to talk just briefly about the juvenile justice reform, youth justice, and just start with a couple of consensus items. I know that this package is complex. I know that it is long and it is aspirational, frankly. And I know that there are a lot of questions swirling about that package on both the DCF side and then also on the DOC side. Consensus items, returning 17-year-olds to the YJ system. We are one of only 3 states that has yet to make this change, and this is really past due. So again, as we see the forest for the trees, that is a change that is absolutely needed in the state of Wisconsin. And additionally, I just want to highlight funding county activities. So if we are going to bring our kids closer to home, if we are going to serve them in the communities where they live, we need to build the continuum that will make that so. So if we look at the long game here, we look at making slow, steady progress towards our desired future. I really want to highlight the community activities to enhance diversion, prevention, and early intervention. The $10 million in this pot would help to unlock the kind of continuum of services that I think would make some of the bigger policy changes a little bit more realistic in future years. So what I want to flag for you is that, you know, I've talked to a lot of counties about this youth justice package at this point, and I often hear philosophically, right at the start, philosophically, people say, we believe this package of proposals moves our system in the direction that we want and need to go. We're moving in the right direction. And I don't take that lightly. I don't think anybody should take that lightly. I think everybody sees the endpoint and the vision that we're looking to get to. I think what I hear loud and clear from counties is we need to keep coming to the table. We need to keep on that path to get there. We need to keep making sure that we have the right tools in our toolbox. We need to keep making sure that we have the right length of runway in order to make those shifts. And I hear you on that. So I want to say from me to you, and I know if Secretary Carr were here, he would say similar, that we are willing to keep this dialogue on youth justice going. We know it's a complicated conversation, but we are absolutely committed to coming to the table. We want to continue this conversation in very close partnership with counties moving forward. And we fully anticipate doing that. So with that, I will pass the baton to Secretary Timberlake, and we'll go from there.
Wonderful. Thank you so much, Secretary Amundsen. And Abby, let's go right to the next slide. So I really want to echo Secretary Amundsen's comments about our commitment across our 2 agencies to be working together. One of the things I have really appreciated about Governor Evers' leadership is his absolute expectation that we as his agency heads connect the dots and that we create that same expectation for our teams. And I hope that you're seeing that that is not just a somewhat corny saying that he likes to refer back to, but it really is the way we do our work. So I said in my opening comments that your voices have really mattered already in the shaping of many of the governor's budget proposals as it relates to the work, certainly of our agency. And I think there is no better slide to start with than this one. We really appreciate that you have a whole package around mental health and substance use disorder services that is part of what you'll be advocating for today. I want to touch on a couple of things that are recommended in the governor's budget and give you just a little bit more of the backstory about why we think these investments are so important. So first of all, we have been hearing from you and your counterparts across the state for years about the gaps and the missing links in our system for responding to and preventing behavioral health crises of one sort or another. We have heard consistently about staffing challenges, funding challenges, lack of crisis beds, lack of inpatient treatment capacity, poor coordination between mental health providers and law enforcement providers across our state. And from the perspective of the Department of Health Services, of course, we have watched the admissions at Winnebago Mental Health continue to go up and up and up. And we have observed that many of those admissions are really for very short-term stays, which says to us that these are people who could be much better cared for, much better treated elsewhere and in other kinds of settings. So the budget proposes a package of investments to create 2 kinds of sets of services to better prevent and treat and respond to behavioral health crisis. First, we're proposing to create 2 regional crisis centers across our state that would have that continuum of triage and assessment and more inpatient treatment capacity than exists currently. And in addition, we're proposing to create 5 regional or support development of 5 regional crisis stabilization facilities that would be more at the level of urgent care and kind of short-term stabilization. So a couple of things to say about this package. First, it is currently still defined fairly broadly for purposes of budget development, and that is because we know that we need to be working in partnership with all of you, in partnership with other care providers across our state to really develop the full parameters of what this package of services would look like, where these kinds of investments would be made. So we've not picked specific places in the state for these investments to occur. We would want to do that in partnership with you. We also know that we need to be identifying ways to create sustainable funding streams through Medicaid reimbursement through private insurance, et cetera. So there's a lot of work to do, but we have to get started. And we believe, based on the feedback we've received from you and in dialogue over the years, that this is the right place to start. Next, you all, I think, are aware that the state Medicaid program now covers residential substance use disorder treatment in larger facilities as of February of this year. But according to restrictions from the Federal Center for Medicare and Medicaid Services, we can't pay for the room and board costs for the actual stay in the residential treatment facility. So for years, those costs have been borne by counties and through other strategies. So the budget proposes a really important investment in funds to help cover the actual room and board cost for that residential substance use disorder treatment benefit. So we think that's essential to making the benefit real. In addition, as we sort of think about working upstream a little bit here and working back along the prevention continuum, we know that counties do amazing work through the CCS program in providing great case management and care coordination and psychosocial rehab kinds of services for people who are living with mental health and substance use disorder challenges. We also know that those programs are limited. We know that there are other providers who could be offering those kinds of services but cannot participate just through the design of the CCS program. And so the psychosocial rehab benefit would extend the ability for some other kinds of providers to participate in providing these services and provide more care to the residents of the communities that you're all focused on. We also know that we've got counties who need to be able to maintain 24-hour coverage on their crisis phone line services in order to qualify for Medicaid claiming for those crisis services. Can be very difficult to secure that kind of 24-hour staffing all across the state. And so there is a proposal to fund some staff who would help back up counties that are otherwise having difficulty sourcing those care providers locally. And in addition, we've got peer-run respite centers across the state that similarly are having trouble keeping the phones staffed. And so there's, again, a modest proposal to help support those services as well. And finally, and really to Diane's opening comments, no more important conversation to be had than the intersection between our law enforcement response and our behavioral health provider response when it comes to people experiencing crisis of one sort or another. And so the budget funds 2 different strategies in this regard. One would be to build out a model that has really shown some success in the state of Oregon, where there's actually a team response between law enforcement and behavioral health providers to particular mental health crisis kinds of calls. And in addition, there's a package of grant funds to expand crisis intervention training services for law enforcement all across our state. Next slide, please. We also know that we rely heavily on our partnerships with county income maintenance providers and the county income maintenance consortia that were created a number of budgets ago. We're still in an economic downturn as a result of the economic effects of the pandemic. We're seeing great increases in Medicaid enrollment, increases in food share enrollment in particular, which tends to lead when we see economic downturns. Just as a specific example for you, the dollars that have been claimed in the food share program from December of 2019 to December of 2020, so after that, end of the first year of the pandemic, doubled in just a year period of time. So remember that that's both a reflection of economic distress for our families across the state, it's also a really important infusion of resources into our grocery stores, our food producers, and everybody who's involved in the food supply chain. So the point is, the work that all of you are doing in income maintenance is critical to making sure that we can connect people to the benefits that they're eligible for, to help them sustain themselves and their families, and to help our local communities and local economy be strong as well. And so there are additional investments proposed in the income maintenance allocation, and I know that's something you'll be talking with legislators about later this morning. Next slide, please. In the area of birth to 3 services, what the governor's budget proposes is a package of investments related to continuing to address childhood lead poisoning. This is one of those longstanding, persistent public health challenges that we just can't quite seem to get ahead of. And so we are proposing investments both in ongoing lead remediation so that we can continue to get to the homes and the windows and the doors in those homes of children who have elevated blood lead levels. And in addition, we're proposing to expand birth to 3 eligibility so that more kids with a lower blood lead level exposure can receive the benefit of the early intervention services in birth to 3. Recognize fully that I believe your current white paper is supportive of the expansion in funding for birth to 3. Looks like there's a little bit more caution around eligibility, and I hope that's something that we can continue to be in dialogue about, because we certainly believe that resources can be identified to meet the needs of these kids, and there's really no better investment, as Secretary Amundsen was noting, no better investment in the future of our state than to invest in that critical 0 to 3 and certainly 0 to 5 timeframe. Next slide, please. So speaking of resources, I just want to take a moment to talk through the ways in which Medicaid expansion can help us support the investments, both that Secretary Amundsen has talked about and that I have touched on so far. So first, when the governor's budget was developed, the governor did assume that Wisconsin would join 38 other states, and the District of Columbia in moving fully into Medicaid expansion. That yields a savings in the way the budget is currently proposed of about $634 million. So in other words, without Medicaid expansion, in order to fully fund everything that the Secretary and I have both talked about, everything else that's in the budget that we care about, another $634 million taxpayer dollars are going to have to be identified from somewhere, or some of these critical investments are going to have to be reduced. So why does my slide say 1.6 billion instead of 634 million? Because when Congress just a few weeks ago passed the American Rescue Plan Act, which was then signed by President Biden, the Congress opted to extend a further incentive to states like Wisconsin to encourage us to move more fully into Medicaid expansion, which creates more federal reimbursement for our Medicaid program, which creates a new $1 billion that has not been fully considered or fully incorporated into the governor's budget proposal. So as you are having conversations with legislators today, Abby, why don't we go to the next slide? As you're having those conversations today, I would ask you to keep 2 things in mind. First, I would ask you to keep in mind the fact that there are critical resources available to our state that we are at serious risk of leaving on the table if we do not proceed with Medicaid expansion. And next, I would ask you to keep this map in mind as we look at how Wisconsin is increasingly an island, not only in the upper Midwest, but really in the entire country as we think about the role that those federal dollars that support the joint federal-state partnership that is the Medicaid program, the role that those dollars could be playing in our state, and the kinds of investments, the kinds of services, the kinds of tax relief even that could be available if we were to move ahead. Next slide, please. So both the Department of Health Services and the Department of Children and Families have fact sheets out on our websites related to the budget proposals that we have both talked through today. And we would certainly encourage you, if you're interested in learning more, to dig back in. I know the DCF link was shared on an earlier slide. And next slide, please. So I would like to wrap up with just two quick slides, if I can make it quick, related to where we are with COVID-19 and a couple of things that have come up of late that we've been asked to speak to. So first, you're aware that just last week, I believe it was, the state Supreme Court did set aside the governor's declaration of a public health emergency, and with that did set aside the statewide mask mandate, eliminated some flexibility that we had been able to provide related to mortuary affairs and the processing of people who have died due to COVID, to create greater safety for our medical examiners and coroners around the state. And so far, anyway, the court's decision also has ended Wisconsin's eligibility for some enhanced food share benefits that the federal government has made available to states. But unfortunately, by a provision of federal law, those benefits are only available to states with a declared public health emergency in place. I say so far, and there's an asterisk after end there, because we are obviously doing everything we can to figure out how we can secure, continue to secure those important benefits for families all across our state. I noted already the incredible growth in demand for the food share program. And again, just as a matter of the state's economy, these food share benefits just in the month of April alone mean $75 million into the economy all across our state. And that's critical for our families. It's also critical for our economy. So we're going to continue to do the best we can to fight for those benefits. Next slide, please. With that said, here are some things I would ask you all to keep in mind in your roles as leaders, organizational leaders, elected officials, and just community leaders and people who are talking to other people out in the world. COVID has not gone away. The Supreme Court may have suspended the governor's declaration of emergency, but it did not suspend COVID-19. And I know that you're seeing that cases are continuing to rise really alarmingly in the states right around us. They are also continuing to rise here in Wisconsin, and of greatest concern, we are seeing cases rise in particular in those under 18 who are not yet eligible, for the most part anyway, to be vaccinated. We also are seeing an increase in the variants, so the mutations of the virus, which are more contagious, do spread more easily. The good news is that cases are not rising in those 65 and older for the most part. And the reason for that, we believe, is because we've been very successful in this state, in particular, in getting vaccinations out to people who are 65 and older. Next, I want to just talk about the news on vaccines from today and also refer you to some resources about how to get vaccinated. You may have seen that just today, the Food and Drug Administration and the CDC did request a temporary pause on the administration of the Johnson & Johnson vaccine due to 6 cases that were identified of a rare blood clotting disorder among more than 7 million Johnson & Johnson vaccine doses that have been given here in the United States. We are currently conducting a webinar as we speak for all of our vaccinator partners all across the state to give them more information. The Committee on Immunization Practices is meeting tomorrow to process this information. There'll be more to come. What I really want to underscore is that this is evidence that the safety protocols that are in place are working. These cases were identified, a pause has been put in place, more guidance will be given, and we'll all know what to do with the J&J vaccine. Meanwhile, the Pfizer and Moderna vaccines are different scientifically in the way they were developed. They continue to be very safe. They continue to be available, and vaccines remain really important. So we've put up the link here for how you can find out more about how to get vaccinated, and really, really strongly encourage everyone to get vaccinated as they have an opportunity to do that. And finally, masks still work. They still work. They are still critically important. If you are in a county with a local mask order in place, thank you. If you are patronizing businesses that are keeping mask requirements in place, please thank them. That's not easy work to be doing right now. If you are connected to school districts, encourage school districts to keep mask policies in place, especially with the spread of COVID cases among young adults. We're back in a situation in the state of Michigan where people cannot get emergency needs met because hospitals are filling up, and we don't want to be back there again here in Wisconsin. So thanks for the opportunity to touch on some important current events as it relates to COVID. I believe that's the last official slide that we have. And with that, Sarah, I'm going to turn it back to you to see how you might like to navigate through any discussion that we may still have just a couple of minutes for. So thanks again so much for the time this morning.
Sure, thank you so much. For folks that are participating in today's event, you can ask questions, and I apologize, I probably should have mentioned this earlier. You can type in your questions either through the chat function or through the Q&A. Also, if you are on the phone and would like to be unmuted, you can press *9, and that will alert us that you would like to be unmuted and wish to ask a question. So if folks have questions, please feel free to type them into the chat Q&A or hit *9 at this time. In the meantime, let's see here. There is a question with regard to why hasn't DHS filed an emergency rule to make sure there is public health emergency to gain the increased food share funding? Is that an option, Secretary Timberlake?
Yep, great question. What we are working to do right now is identify any other administrative steps that we can take, because frankly, that's faster than the emergency rule process. And given the dialogue that and the feedback that we've been receiving from the legislature on other efforts to maintain safety and security in the pandemic, we would rather see what we can do quickly and administratively. With that said, if this topic does come up, would certainly welcome folks underscoring the importance of maintaining those benefits and encouraging the legislature's support for whatever may be required to preserve those benefits for Wisconsin families.
All right, well, we're giving it another minute or so for folks to input their questions in the chat or in the Q&A. I just want a brief response to a few of the comments that we heard from the secretaries. On the childcare piece, Secretary Amundsen, absolutely. We are very supportive of that. WCA is a partner organization in the Wisconsin Infant Toddler Policy Project, and we are very pleased to be a partner in that with that group. Our association is actually going to be participating in a presentation to the legislature's Children's Caucus about childcare and the Infant and Toddler Policy Project specifically. And the portion of that I will be addressing is why counties think it's important that we continue to talk about childcare, even though it may be something that typically you don't hear counties talk about. But why is childcare so important to us as counties? So I'll be making that presentation, I think sometime later this month. That's coming up, maybe even in fact as quickly as next week. In terms of the subsidized guardianship piece, yeah, absolutely. We're talking separate funding outside of those investments in the budget, because we believe that those investments in the budget are so critical to get us to the end pieces that we've been talking about, whether it's in child welfare, whether it is in youth justice. We need to make those investments in our communities so that we can stop sending kids out of state. We can stop sending kids to Lincoln Hills, that we can keep these kids in our community and work with them in the manner in which we would all like to work with them. Let's see here. On the MA expansion, absolutely, Secretary Timberlake, couldn't agree more. It's fascinating. I had a conversation with a legislator, or with a county yesterday, who had some pre-meetings with their legislators prior to Human Services Day. And they were even, again, a number of Republican legislators even beginning to question why it is that they're not moving forward on Medicaid expansion. So I think folks are really starting to think about it. I wish we could just get over this hurdle. To me, it's absolutely ridiculous. I have, in all the years we've been talking about this, never heard a single good reason why we should. Medicaid expansion is a bad idea for the state of Wisconsin. So we hope we can continue to make progress on that. I see we do have a question. If Medicaid expansion is not approved, are there initiatives in the budget on the DHS side that can move forward, or will that jeopardize most of those? Specifically, would the crisis services, increased MA rates, and room and board reimbursement be possible?
Right, I appreciate that question. So I guess I would encourage you to approach it this way. So first of all, Sarah, thank you so much for that feedback. And thank you for those of you who have been in those discussions and are really encouraging people to take another look at Medicaid expansion. I can't stress enough how important it is to be thinking about this in terms of investments in the healthcare and human services infrastructure that people all across our state rely upon. I think the best way to think about the question that was asked as far as what stays and what goes is, honestly, it becomes a very unpleasant game where people advocating for equally important priorities end up fighting with one another, quite literally, to hang on to what's been proposed that we might care about as compared to something else that's been proposed that another stakeholder might care about. And the point is, because at the end of the day, the budget has to end up in balance. And if you take $634 million off the table, you create a $634 million hole that has to be filled one way or the other. The point of our discussion this morning is to remind you that not only does that not need to happen, there is a brand new $1 billion that no one has a specific or dedicated plan for just yet, that could be invested into just about anything that we might like to talk about. So let's be thinking about this in terms of smart investments in healthcare, in human services infrastructure, in communities, and let's see where we go from there.
All right, I don't see any additional questions at this time. Chelsea, do you see anybody?
I don't see any hands raised.
Okay, perfect.
Oh, I did for a second and then they put it down again, so.
Okay, perfect. All right. So with that, I think we are out of time, and I do want to thank both Secretary Amundsen and Secretary Timberlake for joining us this morning and talking to us about these very important issues. I think overall, in terms of positions from, with what we're talking about today, to where, to what's included in the governor's budget, we are there. Maybe not 100%, but we're close. If we're not there, there are ways I know we can work together to get there. And so I do appreciate the time that you guys have given us today to talk about these important issues, as well as the invitation for continued discussion with regard to these items as well. Again, the budget process is a long process, and the next few months, I think, are going to be very busy as we try to navigate through what is going to be and could potentially be a very complicated budget process, one that we have yet to determine what it's going to look like, depending upon what happens with the federal money, what's available to us, what's not available to us, what the legislature decides to do. With the federal money, knowing that it is, in the governor's hands. So it'll be an interesting, I think, next few months for sure. But again, thank you guys so much for your time today. And I think at this point, I'm going to try to reshare my screen. If everybody, you guys know me, I am the least technologically advanced person here. So hopefully I can reshare my screen without screwing everything up. You know what? I don't even see my PowerPoint up right now. So I'm going to take just a moment to, oh, there it is. Okay. I'm not certain what you guys are seeing at the moment.
Right now, I just see you.
All right, so I am now, I found my PowerPoint here, so now I'm going to try to share it once again.
There we go. Now I see it.
Okay, perfect. Thank you. All right, there we go. We are all set. Awesome. Okay, so with the rest of the time that we have available to us today, I am going to walk through the 5-6 issue papers that we sent out to you. The secretaries talked a lot already about what is in the budget, so I'm going to improvise as much as I can here and try not to repeat much of what they have said to us with regard to what is included in the budget. I will say, in putting these issue papers together, This was the toughest and most complicated set of issue papers I think we have ever put together for Human Services Day, especially when we start talking about such things as youth justice, child welfare, and mental health. There is so much in this budget on each one of those issues. And so in this PowerPoint presentation, I am trying to keep it as simple as possible for you, so that when you talk to your legislators about these issues, we can just pick up on the main points. Again, I may have a PowerPoint presentation that's going to explain these things for the next 45 minutes or so, but at the same time, we do know that you guys won't have as much time with your legislators to talk through these things. Again, the other thing I will say is you guys are more expert on these issues. You guys represent the boots on the ground, meaning, you know, the types of things that are included in these papers, you know, are facts that definitely should be shared with legislators. But at the same time, I think really what they are looking for from you is what are the impacts of these changes on your county specifically, as well as on the people that you serve. And I can't stress that enough. Just last week, the Association of Wisconsin Lobbyists held a program where they talked to the co-chairs of the Finance Committee about the budget. And one of the things that co-chair Bourne pointed out, and he actually used the Counties Association as an example, he said, look, I can read the issue papers that the County Association sends out, but when you send your people in to talk to us during the public hearings or to talk to us during your advocacy days, really what is more helpful to them is hearing the stories from you, learning from you what the actual impacts are going to be locally, because those are the things that the legislators really care about. The ins and out of how a program operates isn't necessarily important to them. They want to know how it's going to impact you, the work you do, and the people you serve. So I ask you to keep those things in mind as we're going to go through, you know, what's included in the budget and what we think about them. The more you can personalize it for them as you're talking to your legislators about this, the better. All right, so let's start out talking about youth justice. And youth justice is basically, you know, what we're talking about here is kind of 5 issues that have all been condensed into a single paper. You know, the 5 issues here all relate to the Serious Juvenile Offender Program, Type 1 facilities and SRCCCYs, County Secure Detention Facilities, the Youth Justice Systems Improvement Program, as well as juvenile court jurisdiction. You know, as Secretary Amundsen talked about, I think there's no doubt that as counties, and we support the direction that the budget is going with regard to youth justice. I think where our concern lies is the fact that, you know, we weren't involved in the development of these proposals as counties. We have some concerns that we believe need to be addressed before we can, you know, have the confidence to fully move forward with what is included in the budget. You know, a lot of these concerns deal with timing, infrastructure development, funding. And you know, we think maybe we need to potentially take a little pause on some of those items in the budget, yet allow those discussions to continue. At the same time, though, we do think that there are some positive investments that are included in this state budget that we would like the legislature to maintain. And I think, you know, when the budget first came out, we heard from the co-chairs of the Finance Committee that they, you know, they talked about removing the youth justice pieces wholesale from the budget. And I think one of the things we want to impress upon them is, yes, we think we may need a pause. We think there should be further discussion. If you want to look at this in terms of separate legislation, absolutely willing to work with you guys on this. However, that being said, there are parts of this budget that make significant investments in community-based programs. And none of this can move forward if we don't make those significant investments. Therefore, you know, it's important in this budget that we not just say, you know, we want to shut down discussions on this. We need to have these discussions. We need to make these critical infrastructure investments up front. And then over the next several years, let's figure out how to bring these other pieces in. So in terms of boiling down into, you know, a few sentences, what it is we think about what's included in the budget with regard to youth justice. That would probably be the overall statement that I would make. With regard to some of the more specific things, real quickly, I'm going to go through the 5 specific items that we do point out in this budget. Again, starting with the Serious Juvenile Offender Program. That was a program that was created in the mid-90s, I think 1996, for example. Under that program, youth that meet certain criteria are eligible for a disposition into the Serious Juvenile Offender Program. That in essence allows the Department of Corrections to hold youth beyond the age of 18. That being said, the details of the program and how it operates are not really important for today. What we do want to point out, though, and something that is really critical for counties with regard to the Serious Juvenile Offender Program, is that for those youth that are placed in the Serious Juvenile Offender Program, the financial responsibility for those youth falls with the state and does not fall with the counties. Under the governor's budget, the governor does eliminate the Serious Juvenile Offender Program effective July 1 of 2021, or basically effective with the passage of the budget. Then the budget transfers responsibility for future young offenders to counties, meaning that youth that would have been placed in the Serious Juvenile Offender Program will now be served and paid for by the counties. Again, the other pieces involved in this, the replacement program for the Serious Juvenile Offender Program is known as the Extended Juvenile Jurisdiction Blended Sentencing Model. That begins a year after the Serious Juvenile Offender Program ends. And in order to cover county costs associated with serving youth that would have previously qualified for service for a disposition under the Serious Juvenile Offender Program, the budget provides 5.3 million GPR in the first year of the budget and $13.5 million in the second year of the budget. So the state will argue that while we are giving the serious juvenile offenders back to counties for the provision of services and for fiscal responsibility, the argument will be that but they are providing us the funding in which to serve those youth as well. At this time, our request is that we oppose the transfer of responsibility for former SJO youth to the counties. Again, however, as we talked about in terms of overall thoughts about the package that's included in the budget on youth justice, we do support further discussion between counties and the state with regard to changes in the youth justice system. The reason we are currently opposing the transfer of responsibility for former SJO youth to counties is because counties need sufficient time to plan, to make sure we have appropriate staffing for this population that will be coming back under county responsibility. We also need to make sure that we have appropriate placement options. Right now, the option is likely to place these youth in Lincoln Hills. And if the only option is to place these youth in Lincoln Hills because the current infrastructure doesn't exist in the community to allow our counties to serve these youth, basically the effect of this provision is saying instead of the state paying for placements in Lincoln Hills, the counties are going to be paying for these placements in Lincoln Hills. So we think in the interim, maybe we can move toward a more community-based programming system for these youth. But now we think this really is nothing more than a transfer of fiscal responsibility. Again, once we make that investment in infrastructure and have that infrastructure in place, then we're open to having continued discussions with regard to, county responsibility for these youth. Next item, type 1 facilities, SRCCCYs. Again, no need to get into a definition of what is a type 1 facility other than to say Lincoln Hills, Copper Lake are types of facilities that would meet the type 1 designation. The SRCCCYs, or the Secured Residential Care Centers for Children and Youth. Those are the replacement facilities for Lincoln Hills and Copper Lake once those facilities are allowed to close. They were created 2 legislative sessions ago now with some modifications in the last legislative session. The SRCCCYs are to be operated by counties. The governor in his budget eliminates the state-run type 1 facilities, allows both counties and the state to operate secured residential care centers for children and youth, meaning, when the state builds its replacement facilities for Lincoln Hills, they would like them to look more like SRCCCYs than what they're currently required to look like, which would be another type 1 facility. The budget also removes the July 1, 2021 closure date for Lincoln Hills and Copper Lake, and instead indicates that these facilities will close when all the youth have been transferred to a suitable replacement facility. And then this is the biggie, it's this last bullet point. And the budget removes rate setting authority from the legislature and vests it in the Department of Corrections. So right now, counties pay a daily rate for placements in Lincoln Hills and Copper Lake. As part of the budget process, the Department of Corrections, recommends a rate, and then the legislature ultimately decides what that rate is going to be for the next 2 years that counties are charged for placements in Lincoln Hills. We as counties for years have always supported having legislative oversight over the setting of these daily rates, for fear of what the rates would look like if these rates were no longer in the hands of the legislature and instead were set by DOC. So again, in terms of all of this stuff, I mentioned some of the other pieces in case you get asked, but our requested action today on this is that we oppose the elimination of statutory daily rates. The concern with the statutory daily rates is that the rates could change throughout the year. Right now, when the legislature sets the rates, we know for the next 2 years what it is we are going to be paying, and we can budget appropriately. The other thing we're looking at is there's no doubt Lincoln Hills, Copper Lake always run at a deficit. Included in this budget is an $11 million allocation to wipe out the current deficit for the operations of Lincoln Hills and Copper Lake. That deficit has been, in existence for years. DOC has indicated that if they are in charge and responsible for rate setting, we are going to see these rates increase rather significantly to over $1,000 a day from the current $615 per day. So if you're a county that does not have a lot of, community-based options available to you right now, as an example, and you are required to use Lincoln Hills or need to use Lincoln Hills, your daily cost will increase significantly. I believe the rates that the Department of Corrections used in order to determine how much money they needed to transfer to counties for the serious juvenile offenders, they used, I believe, $1,007 a day for the first year of the budget and $1,009 for the second year of the budget. So again, if you're a county that doesn't have a lot of resources available to it currently, because we don't have that community-based infrastructure in place yet, you'll be paying over $1,000 a day. And there really is no additional revenue coming to counties to assist us in paying those increased rate costs. With regard to county secure detention facilities, there are a number of counties, I think 6 or 7 of them across the state, that currently operate 365 180 programs out of their county secure detention facilities. There is included in statute a dispositional option available to a judge, where a judge can, adjudicate a youth delinquent and then indicate that they will be spending up to 365 days in a county secure detention facility. Counties developed these programs in lieu of sending youth to Lincoln Hills. These counties all do a wonderful job in providing great programming to the youth that they serve. And a number of our counties that are operating these programs, if not all of them, have had great success in serving these youth on a longer term basis. The governor in his budget, though, does eliminate the use of the 365-180 programs effective 1 year after the closure of Lincoln Hills. In addition to that, before I get into our position and why, I do want to talk about another limitation on the 365-180 programs that is included in state law. When the legislation was developed to create SRCCCYs, I think it was the hope that that if counties were to build additional bed space locally, that those additional beds would look more like SRCCCYs as opposed to secure detention beds. So because of that, there's a limitation in current law that says that that counties cannot increase the number of youth that they serve in secure detention facilities through 365-180 programs. The maximum number is tied to an average number of youth that were served in those programs over the last few years. And it basically says after July 1 of 2021, your maximum capacity is now reset at whatever that average was for the last couple of years in terms of number of youth served on an average, based on your average daily population. So our request here is that we oppose the elimination of the 365-180 programs and that we remove that limiting language in the statutes that says that, you know, we can't have populations in our 365-180 programs above the average served between July 2018 and June of 2021. The reason for this is, first of all, you know, we have a concern that we are going to need additional bed space, especially if we're talking about the SJOs coming back under county responsibility in this budget. We didn't even address the 17-year-olds coming back yet under this budget as well. When we tried to determine the number of SRCCCYs that were needed in this state, we looked at the number of beds that were available. You know, we knew that we had 4 counties considering building and operating SRCCCYs. Now we know for sure that 1 county is moving forward at this time. In addition to that, we knew that even if we had all 4 counties moving forward on SRCCCYs, as well as the state building multiple replacement facilities for Lincoln Hills, that there still was going to be a need based on population trends for these 365-180 programs to exist and continue to serve kids. So if we don't have these 365-180 programs in place, we're not certain where all the youth that come into the system will be housed. Again, yes, we know that overall, philosophically, we're trying to get away from housing these youth in facilities and moving toward more community-based placement options and service options. But again, until that infrastructure is built, until that happens, we do need a place to place youth. In addition to that, Lincoln Hills isn't closing on July 1 of 2021. Therefore, we don't think it makes sense at this time to limit the number of 365-180 beds. Again, also, if you're thinking about this, you know, from a county perspective, I'm pretty certain you will be able to place a youth at a 365-180 facility for less than $1,000 a day, which will become the going rate for Lincoln Hills. So we think in terms of, you know, preserving county budgets, preserving needed bed space, we think that, you know, we are opposed to the provision in the budget that eliminates the use of the 365-180 programs. This is the piece of the budget that Secretary Amundsen had talked about, and that's the Youth Justice Systems Improvement Program. This is that piece in the budget, that $10 million investment that is going to be, you know, the cornerstone for additional changes in the system moving forward. What we really need is as much as we're going to raise concerns about a lot of the other pieces that are included in the budget with regard to youth justice, this is the piece that we really need to stress needs to stay in the budget. It's that investment in community-based grants, residential service grants, training systems, all of these things that are going to be critical for us to begin to move toward a more evidence-based approach to serving youth that are justice involved. And so again, as Secretary Amundsen said, this piece is really critical. And I know the legislature is going to be really tempted to say, we're taking everything out of this budget that deals with youth justice. But my fear is if we don't keep this piece in the budget, I don't know if we get it back as outside of the budget process, given its price tag, when we're talking about the other pieces and other changes proposed in the youth justice system. So again, here, this is one provision that we are very supportive of as counties that's included in this budget. And again, this is the piece that's going to really begin to build that community capacity for serving justice-involved youth that we as counties think is so critical to really making some significant changes in the system as a whole. So again, this is the piece we really want to ask our legislators to keep in the budget. Last piece here on youth justice, it's the juvenile court jurisdiction piece. This is really, when they talk about juvenile court jurisdiction, what we're really talking about here is the 17-year-olds. The budget again, and again, as Secretary Amundsen said, we in Wisconsin, we are one of only three states that still treat 17-year-olds as adults. We need to change that. We've had this position for years. The budget creates a sum sufficient appropriation initially funded at $10 million to reimburse counties for their cost in serving 17-year-olds in the youth justice system. We do support this provision, but we do have some questions with regard to the effective dates that we think need to be addressed. First, again, we talked about this earlier, the need to make sure that if we're going to serve additional populations at the county level, that we have the appropriate infrastructure in place. This budget creates has a July 2021 start date for bringing 17-year-olds back into the youth justice system. That doesn't give us as counties time to staff up for serving 17-year-olds, as well as building the community-based resources necessary to serve that 17-year-old population. So we are asking for a starting date of that provision to be pushed back to July of 2022 to give us a year to begin to build that infrastructure. In addition to that, there is some question with regard to the when the additional youth aids funding would be available to counties for reimbursement for serving this population. According to the Fiscal Bureau summary, it says that those dollars would be available in January of 2022. DCF says that they believe that the dollars are available July of 2021. So what we do need is to just receive a clarification to make sure that the funding is available upon the date on which 17-year-olds are first eligible to return to the youth justice system. All right, moving on to child welfare and the child welfare pieces in the budget. Again, Secretary Amundsen talked about a number of these things. First one is the Family First Prevention Services Act. It was a federal law that was adopted in February of 2018, whose focus is really to try to keep families intact. In addition to that, for youth that do need to be placed outside of the home, again, the intention under Family First is to try not to place youth in congregate care settings, but instead to identify and create more family-based environments, more foster homes, for example, for children who cannot remain safely in their homes. But in addition to that, and philosophically, Family First is really a funding model in the sense that it modifies how states can make a claim for federal 4E funding. Under this new legislation, QRTPs, or Qualified Residential Treatment Programs, will be the only type of congregate care facility that will be eligible for 4E reimbursement. But right now, under current Wisconsin law, we don't recognize QRTPs. We don't define what a QRTP is. So we need a change in state law to recognize and define what a QRTP is, so that we can begin to make federal claims for placements in QRTPs moving forward. We need to have these legislative changes in place by September 29th of 2021, or we will not be in compliance with federal law. Again, on this piece, I'm going to go through the background on, I think the child welfare piece is first, then we'll talk about our positions. Second piece in the paper talks about children and family aids. Again, we talked a lot about this in the last budget, so I'm not going to spend a lot of time on this. I believe everybody here is familiar with the children and family aids allocation. Our current allocation is 101.3 million. Prior to the last budget, it was somewhere around 74 million. Again, a lot of great work done last budget with regard to identifying the need for additional resources to serve youth and families in the child welfare system. And even though we did receive this huge increase in the last state budget, we know that the need for additional investment does remain. Again, on the subsidized guardianship program, CAP team members, we talked about this in January. I think the rest of you joining us from Human Services are familiar with it. So real quickly, it's a permanency option for youth in the child welfare system. Our child welfare agencies are required to offer it to all providers who are eligible to receive it. And subsidized guardianships are used typically when the termination of parental rights or parental reunification are not viable options. There are a number of benefits to the use of the subsidized guardianship program, including the fact that when somebody agrees to take on a youth permanently through adoption, they lose their monthly payment that they were receiving either through foster care, for example. And so under the subsidized guardianship program, they're able to maintain a monthly payment because, as we know, one of the barriers to permanency was, an individual's ability to afford, to financially afford to take on another child. So this maintains the monthly payments. It also allows Medicaid eligibility to continue as well for these youth. And again, under a subsidized guardianship, you don't need a termination of parental rights order, meaning somebody doesn't have to go to court and make the case and argue that your family member, for example, or your, close friend like kin, is unfit to care for their child on a permanent basis. And so that it relieves a lot of tension among family members as well when we are able to utilize a subsidized guardianship program. I will say that the subsidized guardianship program, it's a good program. We're not saying at all that the program's bad. All we're just saying is we need to make some changes to how these payments get made. Under the subsidized guardianship program, payments, those monthly payments are currently made by counties through the Children and Family AIDS allocation. At the time that the program was created, counties were told that it was going to be a cost neutral program, meaning that, it wasn't going to cost counties any more money than what we are currently paying out in foster care rates, for example. But we know that that's not true because we know if a youth moves to permanency through adoption, payments stop. We're able to take those dollars that we were utilizing toward that child and reinvest them in other child welfare needs. If a family does reach permanency through adoption and the child has special needs, then there is a payment program called the Adoption Assistance Program that the state operates and the state makes payments from if it is determined that monthly payments are necessary due to the special needs of a child. One of the things we've been finding out with regard to the subsidized guardianship program as well is that these payments continue to compound over time. If we take a look at where we're at in terms of funding for the subsidized guardianship program, the first year the program started, there were 109 kids in receiving a subsidized guardianship payment. In 2020, that number increased to 930 youth. Folks say, why is that? It's simply because many of the youth that were placed in the program in 2013, 14, 15, 16 have not aged out of the program yet each year we continue to bring new youth into the program. At this point in 2020, program costs were just over $5.5 million. The other thing I want to talk about with regard to what's included in the governor's budget with regard to all of these programs, or I should say what's in the governor's budget, is there's a $5 million increase in the Children and Family AIDS allocation in the governor's budget in fiscal 22 and a $10 million increase in fiscal 23. When we do the calendar year fiscal year conversion on the budget, this will equate to a $10 million calendar year increase to counties. In addition to that, all of the language changes that we need to bring the state into compliance with the Family First Prevention Services Act is included in the budget, as well as a $12.3 million investment in in-home prevention services. Again, we talked about that need for that $10 million investment on the youth justice side of things. This $12 million investment in in-home prevention services is extremely critical on the child welfare side of things too. The other thing, again, I will mention, not in the budget, is again, funding for the subsidized guardianship program. Our request here is simple. This is one area where everything we talked about, from the Family First to the increases in the Children and Family AIDS allocation, we support what's in the governor's budget. That makes our ask here a little easier. But what we are asking for, in addition to what's included in the governor's budget, is a statutory change that would transfer payment responsibility for subsidized guardianships to the state in a manner similar to the adoption assistance program. I think, as Secretary Amundsen said earlier today, absolutely, DCF would support this. Just don't take it from these other investments in the program. And we completely agree with Secretary Amundsen on this. Just a couple of talking points on this. Probably the biggest talking point on the Family First piece is if the state does not come into compliance with the federal law, we will lose $8 million in 4E funding. And 4E funding is used by the state to fund not only the Division of Milwaukee Child Protective Services, but there's also 4E funding that counties receive as part of our Children and Family AIDS allocation as well. So it's important, from a financial perspective, in terms of a programmatic one, for the state to be in compliance with Families First. The other thing I will say with regard to Family First is that there is separate legislation moving forward as well to get the statutory language changes in place. Hopefully the separate legislation will pass before the budget passes, but if not, it's important that these things are included. Again, we still talk about, we've talked about for years now, the continued need for investment in the Children and Family AIDS allocation. The other thing to note as well is in the fiscal note with regard to the separate legislation on QRTPs, it is pointed out that the rates for QRTPs will likely be higher than the rates counties are currently paying for out-of-home placements for youth in the child welfare system, and some of them are in the congregate care settings. Therefore, it's important that we maintain that Children and Family AIDS increase, not only just for current costs, but for some future increased costs that we know are going to be coming down as well. Subsidized guardianships, again, why is this important to counties? I think simply because it's really consistent with the payment structure for other permanency options, including the adoption assistance program. The thing to note with regard to subsidized guardianship is that is a permanency option, meaning that once a youth is part of the subsidized guardianship program, it means that counties close the case and we don't provide services to that youth or their guardian anymore. Yet we are still, paying for that, writing checks every month to pay for that service. To us, it doesn't make sense, since the case is closed, for us to be the entity writing the checks and making those payments. Instead, we think it's really important that the state take over that ministerial duty of making those monthly payments. And again, then it would free up additional dollars at the county level for us to invest in other needed child welfare services. All right, let's move on to mental health services. These first couple of slides here, I'm not going to spend a lot of time on. I think everybody understands that counties have by statute the primary responsibility for the well-being, treatment, and care of persons with mental illness and substance use disorders, which means our counties provide a number of services to folks who need mental health services or are in a mental health crisis. Probably the biggest piece of this that we've heard a lot over the last few years, especially from law enforcement, is the emergency detention system and the impacts that has had on law enforcement, the impacts that, you know, the way the current system operates has on the individuals that are served under Chapter 51 in an emergency detention situation. A number of concerns have been raised over the years with regard to the emergency detention system, most notably the fact that the bulk of the emergency detention beds or, you know, psychiatric mental health beds in this state are located in Oshkosh, Wisconsin at Winnebago Mental Health Institute. You know, for a number of counties and law enforcement agencies, it is a significant drive in order to get somebody placed in Winnebago. In addition to that, as we heard from Secretary Timberlake, we also find as well that a number of folks who are in Winnebago are there short-term, that their placement in Winnebago may not have been necessary had it been for additional intermediary placement options in various regions across the state. We also know as well from law enforcement agencies that they spend a lot of time working on medical clearance. There's also a huge time commitment for law enforcement officers related to an emergency detention, from the time they first make contact to the individual, to driving them to the emergency department, to receiving medical clearance, to waiting around to, you know, for counties to find a facility that is willing to accept the individual in the mental health crisis, and then the time it takes for law enforcement to make that round trip to Winnebago and back. It can take, you know, 8, 9, 10 hours in many situations for law enforcement to complete that. And I think law enforcement has, and rightfully so, had lots of discussions with legislators over the years with regard to what, you know, their experiences with the emergency detention system. Unfortunately, what that has led to is a number of legislators offering separate pieces of legislation with regard to the emergency detention process that don't necessarily take into consideration that it is a system and how other parts of the system work. And some of you, you know, there are pieces of legislation most of you out there have not even seen that we're in drafting, that a number of organizations have said we don't think that's a good idea. So we think at this point in time, it makes sense to begin to develop a statewide systemic approach to address these issues. In addition to that, let's talk a little bit about medical assistance and substance use disorder treatment. The medical assistance program does provide coverage of substance abuse treatment in community-based residential settings. Folks can access these programs in a couple of ways. First, through working through the county through a comprehensive community services program, or they can access these residential services through the residential substance use disorder treatment. Medicaid, regardless of how you access this residential treatment, the Medicaid program only funds the treatment portion of the cost of providing substance use disorder treatment in a residential setting. So only the treatment costs are covered, meaning that Medicaid does not cover or fund the room and board costs, which means if somebody is in need of residential substance use treatment, they're on medical assistance, either the individual needs to come up with the funding to pay for room and board, which obviously if somebody's on medical assistance, they may not have the fiscal capacity to do so, or as we see in a number of instances, we do see counties utilizing tax levy dollars to pay for that room and board component of the residential treatment so that the individual can access services. The governor's budget with regard to mental health provides $12.3 million in fiscal year 23 and to establish up to 2 regional crisis response centers. Again, not really defined in the budget in terms of operational costs, in terms of who's operating these facilities, where they're going to be located, all of that. In addition, there's $5 million included in the budget in fiscal year 23 as well to establish 5 regional crisis stabilization facilities. Again, who's operating them, how the operating costs will be covered, where they're to be located, all of this is yet to be determined. In addition to that, the budget directs the Department of Health Services to pay allowable charges on behalf of recipients of MA for room and board for residential substance use disorder treatment. And the budget also increases Medicaid reimbursement rates for outpatient services for mental health and substance abuse and for day treatment services for children and adolescents. And these reimbursement rates, the increase is pretty significant. It's 20%, I believe, in the first year of the budget, 20% in the second year. So in total, a 40% increase in these rates. Our requested action on this is that we support the governor's recommendation 100% with regard to the residential substance use disorder room and board payments. These are, these residential programs are important. I think that's why we see a number of counties paying out of levy dollars for the room and board portion of it. Yet that's not really, the county shouldn't have to be doing that. What this provision is going to do is increase access to residential substance use treatment for folks that need it. In addition to that, we do want to support the governor's recommendations with regard to the increased MA rates. I don't think it's any secret, and again, folks have talked about for years how the MA rates don't come anywhere near to covering the actual costs of providing mental health services to folks in the community. And so we want to make sure that we continue to get these rates as close as possible to actual cost so that we can again begin to build that network of providers in the state that we know is so sorely needed. In addition to that, with regard to the regional crisis centers and the regional crisis stabilization facilities that are included in the budget, this is where things get tricky. We are part of a coalition that is working on an alternative proposal that we think will better guarantee the availability of regional services to those that are in need, and that will ensure that services will be provided in every region of the state. I can't say much more than that right now to you, but in talking to your legislators about this, I would simply state that this budget needs to contain funding to construct the infrastructure necessary to support regional behavioral health facilities to serve individuals experiencing a mental health crisis, and then let them know that WCA, in a coalition with the Wisconsin Hospital Association, the Badger State Sheriff's Association, the Sheriff's and Deputy Sheriff's Association, the Chiefs of Police, the Psychiatric Association, the Wisconsin chapter of emergency room physicians, we're all working together to develop a proposal that we think will be ready for prime time sometime, I think, in the next week or two. So again, let them know that there will be more to come on that particular issue. I think I already talked about all the talking points in this. So we'll move on in the interest of time to child support. Again, Secretary Amundsen talked about this. Again, it's counties are the entity that is required to contract with the Department of Children and Families to implement and administer the child support program. This program is funded through a combination of state, federal, and county funds. I think as we've seen over the years, our costs to operate the child support program continues to increase, whether it's from growing caseloads or whether it's from new federal regulations coming down. One thing we need to talk about with regard to child support funding is how the federal funds get allocated. Federal funds with regard to child support come down based on performance. They basically rank every state in a number of, I think, 5 or 6 different categories, and your federal funding is based upon how you fall within those ranks. Wisconsin has been falling in the rankings lately, meaning I believe we've lost a couple $1 million now over the last few years due to our decrease in rankings. In addition to that, we have lost some state and federal, some funding due to over the last few years because of changes to state and federal law or interpretations of law with regard to the birth cost recovery program. At the state level, we're no longer allowed to go after birth fathers for birth cost reimbursement if the father is currently living with the mother. In addition to that, right after the last state budget passed, our friends in the state of Michigan received an answer from an inquiry they made of the federal government, which they never should have made, with regard to whether or not birth cost recovery dollars that were reinvested in the child support system would be eligible for federal matching funds. Because Michigan asked the question, we got the answer, and the answer was no. So that meant that in Wisconsin, we were going to lose an additional $4 million in federal funding related to child support. Currently in Wisconsin, our county child support agencies receive $9 million in GPR funding. Again, matched almost 2-for-1 by federal funds. The governor's budget, and we are so pleased that this is in the governor's budget, makes a significant GPR investment in the child support program. It provides an additional $4 million GPR annually, plus an additional $7.7 million in federal matching funds. Here, we want everyone to support the governor's recommendation. There was confusion, I think, in the last budget with regard to the request in the child support area. The Joint Finance Committee cut the request last budget by 2/3, and therefore we only received 1/3 of the request, which means we only received 1/3 of the dollars that were needed. This budget, it is critically important that we talk about the need to provide 100% of the funding that was requested by the Wisconsin the Wisconsin Child Support Enforcement Association, that is supported by WCA. We need those dollars, especially because just in the federal birth cost recovery change alone, we lost $4.2 million annually. None of that talks about how it is we can increase, and that just gets us back to where we're at, gets us back to even in terms of, that GPR funding. But then we need this federal match as well. We need this full $11 million because, again, we're falling in the rankings. We're beginning to lose federal funding as a result of that. In terms of why they should make this investment, in terms of the whole federal funding piece, child support is a really great investment it's a really great investment for the state. We collect $6.20 in support for every dollar that's invested in the program. In addition to that, if our child support agencies are successful, it saves the state funding in other programs such as Medicaid, such as food share. And so to the extent that we can talk about the value of the child support program and why this investment is necessary, we need to do so. Income Maintenance Administration allocation, again, not going to spend a lot of time on this because Secretary Amundsen did, but these are the dollars that we receive as counties to perform the eligibility determinations for the Medicaid and food share program. Over the last several years, we have worked really hard to not lose ground in the program by requesting the state provide additional funding every single time there's been a change in workload or a change in caseload. What we've been seeing with regard to this pandemic is an increase in caseload with regard to the Medicaid and the food share program. You can see on the slide what the state is anticipating our caseload growth to be through the end of this current biennium, and it is rather significant. In addition to that, every budget, we also talk about the Fraud Prevention and Intervention Program. Under the FPIP program, it is again, our counties are required to operate an FPIP or fraud prevention and investigation program, to look for overpayments that are made in the food share and medical assistance program, as well as to look for folks that may be making intentional program violations. The governor's budget provides increased funding in both years in the Income Maintenance Administration allocation to fund the projected workload increase based on these increasing numbers that we're seeing in terms of Medicaid and food share, again, due to the pandemic. So what we're asking for here is that we support the governor's recommendation with regard to the IMAA. In addition to that, the last several budgets, we've asked for increases in FPIP funding, $500,000 a year. This is our continued request to continue to build funding in the FPIP program so we can begin to investigate all of the cases that need to get investigated. Again, because this is a 50-50 match program, really the ask here is $250,000 state GPR in each year of the budget for FPIP. It's a really small bucket. It's a small ask. Drop in the bucket in terms of the state's terms of the state's budget, but again, it's important for us, and we'll continue to make that ask of members of the Finance Committee as we've done the last few years. Again, important thing to note here, that increase in the Income Maintenance Administration allocation, in essence, makes sure that we as counties don't lose ground by allowing us to maintain the same level of support per case that we received in 2020. Last issue to talk about here is the Birth to 3 program. Again, it's an early intervention program for infants and toddlers with developmental delays and disabilities. Counties are operating the program at the local level, funded through a combination of state, federal, and local revenue. We see program costs continue to increase every year. And since counties fund the highest percentage of program costs, you can imagine which entity is paying for those increased program costs on an annual basis. The budget does a couple of things with regard to the Birth to 3 program. First, it maintains the $1.125 million increase we received in the last budget. Important that we keep that. In addition to that, the budget expands Birth to 3 services to children who meet a new definition of lead poisoning. The state is going to utilize the CDC definition of lead poisoning moving forward, which means more children would be eligible to be served under the Birth to 3 program. And the governor provides $3.3 million in fiscal 22 and $6.6 million in fiscal 23 to cover that expanded population. Our request here is that we maintain the governor's funding levels, but we delete the language expanding program eligibility. Why do we do that? Because counties right now are having difficulty meeting the needs of children and funding children that are currently eligible for the Birth to 3 program. We believe that we need to make sure that funding is available for those kids that are currently eligible before we expand program eligibility. As counties, we did make a request of the administration for an increase in the Birth to 3 program of $4 million annually without making a request to expand program eligibility. So we think this funding included in the budget goes a long way to meeting what our county request was. But again, don't expand program eligibility until we have the ability to fund the kids that are already eligible for the program. So with that, I'm going to end my comments here. I'm going to look to see if folks have questions. Again, if folks have questions, type them into the chat box, the Q&A feature, or press *9 to unmute. So let's see here in the chat. Let's see, we need some sufficient clause in the SJO proposal. There's no assurance that counties can serve them for the same cost as the state. There's an economy of scale that will not exist when this change is made. Mark Mertens, absolutely couldn't agree with you more that if the SJO population is going to come back to counties, The appropriation that comes with it should be sum sufficient, very much similar to the sum sufficient appropriation that is being created for 17-year-olds. Absolutely. Let's see. Also, Milwaukee County asking legislators for a moratorium on daily rate increases, give us an opportunity to reinvest in effective community alternatives. Excellent point, Mark, as well. Question on the QRTP legislation. Does this need to be in statute, or is it possible for DCF to make rules related to this without statutory change? Wouldn't existing residential care programs make changes to become QRTPs and recognized as such? Eric, it's my understanding based on conversations with DCF that they believe that statutory changes are necessary to bring us into compliance with federal law. In addition to that, I believe DCF also believes that, that they may not have rulemaking authority to move forward with regard to bringing us into compliance with QRTP. State agencies typically don't have the ability to just write rules on their own. They need to have a basis in statute in which to create those rules. And so I am guessing that DCF believes that they need these statutory changes to allow them to move forward with the rulemaking process. So hopefully, okay, Eric, okay. Thank you, Eric. Okay, good. I hope that answered the question then. I don't see anything else in the Q&A or in the chat, and I know we are over time. So if Chelsea, anybody with a raised hand?
No, I don't see any.
Okay, perfect. All right, so with that, just a couple of reminders. You received the feedback form. Please be sure to send me your feedback form upon the conclusions of your meetings, whether your meetings happen today, whether your meetings happen a week from now. It's really important for us to get that feedback from you, not only with regard to who you met with, but what their reactions were to our requests. With that, I think that is all we have for today. And I want to thank all of you for participating, not only in this 2-hour, formal Human Services Day presentation, but also want to thank all of you as well for the time that you are investing in meeting with your legislators to talk about these really critical issues that are included in the governor's budget. So again, thank you guys so much for your time. And if questions come up throughout your meetings, please feel free to contact me at the WCA office. So thank you so much, and good luck to all of you with your meetings moving forward.